Welcome to Brian Says, and welcome to IDOC, believe it or not. Lyme disease, what is it? Well, untreated Lyme disease can lead to many serious problems if left untreated, as I said. But if one happens to be using drugs and living a life that is less than stable, then one does pick up a few things at times. In this instance, an offender was having some health issues, and while it's one thing to be in jail for drugs, it is quite another to be in jail and be ill. And obviously, if you've been using drugs and you're on the run, so to speak, you have no idea really what your health is actually like. And so the drugs actually cover up lots of different things. And so this is just setting up, of course, the bad joke, which is an offender walks into my office. So in this case, this offender was walking into my office carrying a pad and paper. And he was kind of curious. That usually isn't what's happening. So I asked him what was going on. And so the story began. So they had just arrived from a different prison where they had received a drug DUI. And the story went that they could not maintain their heart rate, and so they were taken to the hospital. In fact, if I understood properly or correctly, their heart had actually stopped beating, and they were not able to get it going. And that all sounded a little odd until, the story took another turn. So while they were telling me the story, they said, okay, but also the officers and the warden said that I overdosed, but I didn't overdose. I have Lyme disease. So they said they had been diagnosed with Lyme disease and it had been undiagnosed for some time. One of the symptoms of this disease, undiagnosed, is memory loss and the inability to remember things, or having a fog around your memory. So they were writing things down while they were meeting with me in my office. I was like, okay, nope, no big deal. And they also told me that in order to get better, they had to have treatment, and also they also needed to be getting potassium supplements as well, which would help with their heart. And I was like, okay, awesome. And I thought everything was, being taken care of. So then it took kind of a strange turn. So they'd been at the prison for a little bit, not very long, and the warden from East Boise, Gretchen Woodland, decided to come over and talk to them. That's kind of odd, because usually wardens don't make it a point to seek out offenders who left the prison. So, okay, whatever. But maybe, and I was thinking that maybe she came over to show compassion, to check in with her and say, hey, I'm hoping you feel better, stuff like that. But no, that was not the case. So Warden Woodland came over to intimidate and bully this offender. And also, almost immediately after Woodland left, I had offenders coming into my office and telling me what had happened. And that was one thing. I needed to wait for the offender themselves to come forward. But this is what Woodland was reported to have said and later confirmed by the offender. Woodland said to this offender, "You are a despicable human being." I thought that was not okay, and it's definitely not acceptable. So here, the viewer needs to keep a few things in mind. One, no one can believe anything that the offenders say. That's just like a rule, right? Number two, wardens can say and do pretty much anything they want. The prisons are their realm. They're the kings and queens, and the squires and all those things are underneath them. Number three, what occurred with this offender, going to the hospital, having a heart that wasn't working properly, that was all pretty strange, and I was working to substantiate it. And four, keep in mind, was presenting in my office as somebody who was struggling with their memory and had just been in the hospital for their health, and so they were not in the best shape, even at that point. So keeping all those things in mind, even as staff, we try to tread carefully. And for context around what I could or could not do, keep in mind that this is the Warden Woodland, and go to Woodland Conspiracy for more context, who actively refused to acknowledge drug use, take any steps regarding drug use, and then the steps that they did take, or Woodland did take, she took steps to stop my reporting of drugs manufacturing a false narrative, attempting, well, and she did actually, discrediting me to the point where they said I was being inappropriate. But as I said, all that's under the Woodland conspiracy, and you can take a look at that. So there was obviously a lot happening around this situation, and I was being as cautious as I could because something was off between Woodland and Drake and Shoemaker. I just didn't know what it was because at that point in time, nobody had said anything to me and wouldn't until after I was terminated. So I told the offender, look, these things are very concerning. You need witness statements, and I strongly suggest that you get those from those who have already reported that this happened. And so I'm going back to the people lying in prison. This happens all the time. But in this situation, I was being lied to very directly by Woodland, by Drake, and by Shoemaker. So I had random offenders coming up to me and saying, yeah, I saw it, but there's no way in heck I'm going to put my name on anything because Woodland will come after me and I want to go over there and she will stop me. So they were afraid of retaliation, and that's normal. So I asked a lot of questions, and as I started asking more questions, this is what happened. So the situation got even more strange. They went to medical, which obviously they're getting treatment for Lyme disease. Well, just like with my office and showing up, they brought their paper and wrote everything down, right? Not a big deal. Well, medical staff saw that as an affront to them somehow for writing things down. And so they got mad at this offender. And so they were like, they tried to explain what was going on, and apparently medical continued to get mad at him. And finally, they just yelled at him and said, get out of my office. You no longer have Lyme disease. We're not doing anything for you. Leave. And here's the thing you need to know. If you're giving a directive by any staff and you don't leave, you can get a DOR and lose your date to get out. That's a very serious offense. So medical doing that to somebody who was obviously in a delicate state was very irregular and, dangerous to that offender. That is a problem on so many different levels. And so just so you know, this wasn't the first time, as you are starting to see, that medical has told an offender, hey, you may have this disease, but now you no longer have it. In fact, I started seeing this over the years working for IDOC as a common occurrence. So the easiest way to deny medical treatment to an offender is to change the diagnosis. Oh, you hurt your hand? No, you did not. You broke your hand? No, it's not broken. You need insulin? You're not a diabetic. It is literally that easy, and that's what they do. And so I did, as according to policy, I let my supervisor know what I was seeing, what I was being told, and you can, of course, look into the context of, this is how Drake would respond. With Drake, I immediately received pushback from her and indifference. And of course, the offender is obviously lying, and that was that. And it was just weird. But again, the whole situation with Woodland, Drake, and Shoemaker was also happening at the same time. So that was all another issue. It was bizarre. So something about the whole thing just seemed off and out of the ordinary. So medical during my time at IDOC would not only deny offenders their medications that they needed to stay alive, they would also make excuses as to why they were not even providing life-affirming pain relief. This was not an aberration anymore. This was SOP, standard operating procedure for IDOC. They actively denied IDOC, would deny medicals. Boy, let's see if I can say it properly. IDOC would actively deny medical treatment to the offenders, and this was common. And in this specific situation, as I let my supervisors know of the issue, they then removed this offender from my caseload. And that is a very simple story of how IDOC denies healthcare. This segment is on Lyme disease. IDOC, believe it or not,